Hello everyone, Assalamualaikum. Welcome back to Unit 6. We'll be talking about topic number 2, which is dental lab. Specific learning outcomes, there are two. The first one is to identify risk and potential infectious agent transmission via several medium in the dental prosthetic lab, and demonstrate appropriate methods and techniques for infection prevention and control when dealing with prostheses. Okay, so the dental lab should be isolated from the possible transmission of pathogens or be properly prepared to prevent cross-contamination between patients and dental technicians. In other cases, to protect the dental students or to protect any other workers in the dental lab. All right, so we are trying to prevent the microorganism transfer from the dental clinic to the dental lab, regardless who's working where or who's doing what. Okay. And some studies have reported that organisms are transmitted from impressions to cast and from dentures to pumice when they continue to live. So what it means is that when the impressions taken in the dental clinic, and once it's done, the impression sent to the dental lab to fabricate a cast, and what they found that the cast itself has been contaminated from the impressions. Okay, similar to the pumice, where the dentures from the dental clinic probably were sent to the lab for repair or for the final finishing. Then the dental technician using pumice to polish it up, but then they found that the pumice itself is contaminated from the dentures. So we need to prevent these events so that we can keep the dental lab safe and also prevent further transmission. Okay. So there are two articles that I would like to highlight today. The first one is by Agostino et al. 2004. They said that the polishing of dental prostheses is a possible source of transmission of communicable diseases in the laboratory. And Software et al. 2002 mentioned about bacterial growth was recorded in 61.3% of disinfected impressions, and the numbers of bacteria in disinfected and non-disinfected impressions were about similar. So this is quite an alarming numbers, quite alarming fact that we need to take note and take action perhaps, It says that even though we did disinfect the impressions in the dental clinic before we sent to the lab, they still find the bacteria on the impression when it arrives in the lab. So what does it mean really whether the disinfection in the dental clinic was not done at all or was not done properly, or there's something wrong with the transport from the clinic to the lab, the method of transport or the medium that they're using perhaps contaminated too. So we have to be very meticulous in terms of handling the impressions or anything from the dental clinic to the dental lab. Okay. All right. Looking at the occupational risk in the dental lab, there will be direct contact, contamination, airborne, splatter, and also indirect contact. So these are almost similar what happened in the dental clinic too. So you can see these kind of risks do exist in the dental lab. So possible transmission from the dental clinic to the dental lab are via impressions, casts, impression trays, record bases, occlusal rims, articulators, and dental prostheses. So whatever sent to the lab from the dental clinic impose a significant risk of contamination or transfer of microorganisms from the clinic to the lab. Okay, so we need to take note of this quite carefully. All right, so looking at the design of the lab, so we're talking about not a dental clinic, but a dental lab now. So looking at the design of the lab itself, it has to be more practical, it has to be more uh, cautious in terms of infection prevention and control. So as you're looking at the photos here, it's showing us a counter of designated to receive any cases or any prostheses from the clinic outside the lab. So you can see this is a designated receiving counter for the lab. So anything goes in gonna go through this counter. So the flow actually starts from here. And then there is another counter for the customer or any dispatchers to take the final products from the lab. So there will be issuing counter instead. So the design of the lab itself must be more practical in terms of handling the issues of infection prevention and control. Okay, so there will be a separate area as well for disinfection process if it's required. So by right, we don't need to disinfect any um, what we call this items or prostheses received in the lab because we are expecting them to do the disinfection in the clinic before the transfer to the lab. Okay. All right. Looking at this dental lab PPEs, everyone who are working in the dental lab is expecting to wear one of these, some of these PPEs. So look, just gonna go one by one. Looking at the goggles should be worn at all times because there's a lot of splatter, a lot of risk of eye injuries as well in the lab. Okay, so we need to have the goggles worn at all times. Disposable gloves should be used when there is a potential for direct hand contact with contaminated items. So you don't really have to wear gloves at all times in the dental lab, only when there is a potential for direct hand contact with the contaminated items. That's all. All right. However, we do need you to wear um, the jacket or the lab coat, the white one there, and it should be changed daily and should not be worn outside the laboratory. Okay. But when you're dealing with some water or splatter possible procedures, then you probably have to wear this white apron, disposable apron when dealing with any possible splatter, right? Okay, so that's one of the options there. The next one is the mask. So the most popular PPE nowadays, masks should be worn at all times in the dental lab. Okay. Right, looking at the procedures itself, what I mentioned earlier about the items or the prostheses or anything that will be sent to the lab need to be disinfected first before they leave the dental clinic. Okay, so that is the main idea of all the protocols here. So please do make sure that you disinfect anything at all or any single items that you're going to send to the dental lab in disinfect first in the dental clinic. Okay, so when you do disinfect them, there are many protocols involving different types of prostheses or different types of materials. So that will be highlighted soon too. All right, so looking at these procedures for disinfection, inside the dental clinic before sending to the dental lab. We're going to go over several types of prostheses or materials. The first one is the wax bite rims or the bite registration, which is using a wax. So the immersion disinfection may cause distortion to some items. So maybe just using iodophor disinfection sprays instead. Okay. For ZOE or zinc oxide eugenol and compound impressions, they can actually be immersed in 2% glutaraldehyde or a 1 to 213 iodophor solution for 10 minutes. Okay, so the contact time here is required is for 10 minutes. Anything less would be less effective. So you may not get a total disinfection result. For impression compound, however, the immersion in sodium hypochlorite or the well-known, we say Clorox as one of the brand name, diluted in 1 to 10 is actually suggested. All right, so you can use that for suggestion, but there are a lot of other products available out there that you can choose which contain this such agent. Okay. And the next one is irreversible hydrocolloid agar, or the most popular one is called alginate. It should be rinsed actually after the impressions taken out from the mouth. It should be rinsed quite thoroughly to remove any debris from the or blood from the impressions, and then soak by spraying with a hospital level disinfectant, preferably iodophors, sodium hypochlorite 1 to 10, chlorine dioxide or other approved products are acceptable. So you could see in the market, what are the available products and look at the active ingredient. The active ingredient must have one of these agents so that it can be more effective. Okay, for dental prostheses, mainly we're looking at the chrome cobalt metal framework. Normally we need to follow the manufacturer's recommendations, so that if we do not follow that, it might cause a lot of problem, especially the corrosion if you have more contact time or different products. Okay. All right, for impression trays, aluminum chrome plated made. It should be heat sterilized via autoclave, chemical vapor or dry heat, or even ethylene oxide sterilization. For custom acrylic resin, or we call it custom tray, please do discard after intraoral use in a patient, or you can disinfect with tuberculosidal hospital disinfectant for reuse for the same patients on their next visit. Okay, and lastly, for the cast, where disinfection of impression material was compromised. So normally we don't disinfect cast at all, but then if we do suspect there are possible contamination due to the impression material, so we need to spray with an iodophor or chlorine product, and then rinse in the aseptic manner to the and transfer to the production area. So again, it is quite difficult for us to disinfect dental cast because the material itself is quite porous, and it might jeopardize the integrity of the cast itself. So hopefully that we have done a proper disinfection of the impression material first, and then we don't have to worry about having the cast being contaminated. All right, everyone, thank you. I think that's all for the dental lab. Bye.